and she is a specialist at the DigiHealth Hub Concept and Ecosystem Collaboration at the Centre for Health and Technology at the University of Oulu. So Satu, I will hand over to you now.
Thank you. Let me share my presentation. All right. So I'm Satu Väinämo from Centre of Health and Technology Unit at University of Oulu, Finland. My presentation includes some words first about the Oulu Health ecosystem in which we are a member of. Then I will tell you a little bit about DigiHealth Hub and our practices. And then I will close the link to the regional agendas. The Oulu Health ecosystem is an innovation ecosystem in Oulu region. The principal idea is to facilitate the open collaboration and to accelerate innovation by bringing together various partners. The ecosystem comprises several stakeholders from academia and the public and private sector. The ecosystem approach enables the combination of diverse expertise to introduce, for instance, smart solutions for healthcare. Our unit, the Centre of Health and Technology, is responsible for research and innovation and outreaching activities. The other activities of the ecosystem is business development and testing. The new technologies and the utilization of data are changing the healthcare. However, there is a need to increase the expertise and the capability in the health data management and modeling. Also, increasing and building the competences to use the data analytics and AI tools in the data-driven economy, especially in startup and SME ecosystems, is needed. Furthermore, the stakeholders of this ecosystem or other stakeholders, they have a different kind of challenges and capabilities in utilization in data and AI, which brings some challenges there too. To answer these needs, we established DigiHealth Hub 2 years ago. We are focusing in 2 topics, what is health data practices and competencies in analysis for data-driven health and well-being innovation. And this is where I'm concentrating in this presentation and giving you some examples. The other topic is deployment and assessing the digital health services. And the third one is ecosystem collaboration and strategic partnerships, which links these 2 topics as it actually defines the collaboration models and the hub concepts. The main activities of the hub is creating new knowledge and guidance by providing practical tools to help the utilization of health data. We are also sharing the best practices and success stories in development and implementation of novel data-driven services. Thirdly, we are opening new collaboration opportunities by building and coordinating new research and innovation partnerships. The first example here is the health data guide, what is designed to provide the practical information on healthcare data and analytics for researchers and companies. This guide is really contains the basics of the utilization of health data and machine learning. So this is really not for experts, but who are really beginners. This is a practical and step-by-step guidance when starting the research, development or innovation project preparations when utilizing health data. You can find more information about this from the link what I have added to the slide. Next one is a tool, the health data assessment tool. It's a self-assessment tool, kind of a checklist for assessing the quality, quantity, and usability of health data for researchers and business. It covers the most critical aspects of assessing data quality, and reusability. The third example is not a tool, but it's a National Health Data Analytics Network. The Ministry of Social Affairs and Health has mandated the University of Oulu to lead the partnership network creation and competence building in this topic. This is done within the National HYTE-AIRO program, which gives the framework for the collaboration. The objective of this network is awareness rising, and this we are done by gathering existing best practices throughout the network. And we are giving the webinars currently in this situation, only the webinars where we share these best practices. The other objectives is competence building towards AI-assist knowledge management and predictive data-based service models. We are all the time building and finding the new partners to this partnership that we can peer learn each other the best practices, also to bring increase our competencies in the area of health data and AI utilization. The focus is the acceleration of secondary use of health data in research and development, and especially focusing of using AI there. We see that the Digital Health Hub has been the starting point to build the competencies on digital and data skills. We are continuing these activities within the regional, national and international agendas for upcoming years. There is even the 7 years programs there where we will continue. So it's not stopping now, but we are really continue it several years ahead. Currently, we are implementing the regional program 2019-2020 by building this digital or establishing this digital health hub and increasing the expertise and knowledge in this area. Also, we are implementing the smart specialization strategy where the health and welfare sector is seen as a regional strength. Internationally, we are the active member of Personalized Medicine Thematic Partnership of S3. And there we are building together with the Belgium and Dutch partners an investment project of personal data platform. What is then the role of regional actors? I have here 3 different actors in Oulu. And the city of Oulu is, for instance, Cities Oulu is currently creating the data strategy. And they are establishing or even established already the local My Data Hub, where they are defining the citizen-centric data models. The open access to data, they have now done it a few years with the 6 biggest cities in Finland, and they are finding the standardization. This is mainly for smart city data. The University of Oulu, in addition to this digital health hub, have established the data services, which includes the legal and data experts to help researchers in the issues or challenges in utilizing the data. The university hospital, which is building the new future smart hospital 2030 is not only building the walls, but they are changing all their processes and looking all the opportunities of new technologies. They are defining, for example, this data governance models and for the smart decision systems and the data lakes. This was actually all. I have put it here to some topics if you are interested in the collaboration and also the contact information. Thank you very much for this opportunity.
Thanks, Satu, for this really interesting input. What's, according to you, the role of the regional authorities in this whole picture?
Sorry, can you repeat the question? What is
the
role of
the regional authorities? So because you told us you shared a really interesting picture of all the different partners at the different levels. So, but if the other regions could learn about it, what would be your tips or recommendations?
Okay, so how we see it, it's the when you start to utilize the data, it's not only the access to data, but also to have the competencies and expertise. And as the different stakeholders have different ones, it's really important to really figure out the challenges and try to find the solutions. So in our case, we have now created these tools to help also. It actually doesn't, those tools, what I told you, it doesn't strict to the only our region, but I believe that you can actually utilize them all over the Europe. Those documents or tools what are used, and also I see that the peer learning and networking, partnership networking is really important, where you can change the knowledge and expertise. So that would be my answer or tips. So really focus on also building up the competencies and capabilities.
So over time now, so SAPHIRE, your